Hello, Mr. Minisee. Welcome to your personal diabetic education video, and thank you for responding to our survey. It's obvious that you care about your future and issues that you may face as a newly diagnosed diabetic. I see that your motivation is remaining free of insulin use, and we hope to address all the areas of interest that you included on your survey. You'll also receive a free glucometer to assess your blood sugar levels. There will be a demonstration about that toward the end of the video. Some topics you wish to discuss include information about, let's see, on your survey here. Yes, that's you. It says incidence of diabetes, the effects of diabetes on your mind, your body, and your finances. We'll also talk about social issues that you may encounter, and presenting signs of diabetes, and just a basic overall look at what diabetes is. There are 25.8 million diabetics in the United States, as 8.3% of Americans are diabetic. Diabetes is a leading cause of kidney failure, lower limb amputations, and many cases of blindness among Americans. Diabetes is a major cause of heart disease and stroke. It's the 7th leading cause of death in the United States. Factors that put you at risk for diabetes include older age, being overweight, history of diabetes in your family, not being active, your race and ethnicity impacts whether or not you're at risk, and some of the signs that you may notice as a diabetic, especially when it's out of control, is that you're going to the bathroom a lot, you're extremely thirsty, you have weight loss without trying, you're feeling tired, you may have neuropathy, which is tingling. You can find that in your extremities, your arms, your legs, your feet. Other signs include vision problems, blurred vision, and skin that's dry and itchy, wounds that take a long time to heal. So at this point, let's talk about the effects of diabetes to the way that you think. How it affects your body and finances. Diabetics have weaker immune systems, so this puts them at risk more so than other people, and it could possibly decrease your lifespan. It usually takes place if the condition is not well managed. The result could be loss of limbs and vision, which is one of the things we discussed earlier. And economically, the cost of medical care associated with diabetics can be a burden to your family because it can range anywhere from as little as 20% or more of the annual cost of care that you are responsible for. This condition may impact you emotionally and psychologically because of fears associated with the condition. What's going to happen to me now? Some also experience denial about the condition, embarrassment, anger, and depression. And it's finally acceptance that we hope that you will experience. In regard to specific socio-cultural aspects, African Americans are 75 or 77% more likely to develop diabetes than non-Hispanic whites. The most common social effect of diabetes is the fear that others will make a big deal out of the issue or condition. Instances of discrimination and isolation affect diabetics. Sometimes people don't know how to deal with you as a diabetic. They don't want to be around in case something happens. A third common feature is choosing to blend in with everyone else instead of managing self-care effectively. What we mean by that is if you are accustomed to eating out, or regularly you like to drink and you go out with people and you're in the company of others, you may be tempted to do the same things that they're doing. Resisting the offers can sometimes result in questions or unwanted remarks because there's a misunderstanding about why you're not joining in. Okay, so at this point, we will go on to listen to Carol, our next educator, and she's going to discuss plans for the management of your diabetes.
Hello, Mr. Minisee. Today we will discuss the 5 crucial steps to manage your type 2 diabetes. The first step will concentrate on weight loss. Your current weight is 257 pounds. Carrying extra weight makes it difficult to use the insulin in the body that's still being produced. Even a 5 to 10% reduction will take away stress on the heart and lungs that also work harder at this present weight. Type 2 diabetes is largely a lifestyle disease. Making changes to diet and activity levels decreases weight and blood sugar levels. Step 2, encourage an attitude change about foods. A diet plan does not mean food is the enemy, even if you believe food was the cause of the diabetic diagnosis. The trick is in choosing the right food in proportion sizes. Choose carbohydrates or carbs carefully because of its effect on blood glucose. Starches and processed food contains many carbs that affect glucose. A list of food items to avoid or eat sparingly will be provided in the written portion of your diabetic education. It will be suggested consumption of carbs that come from legumes or vegetables that have lower number of carbs offer fiber sources. Smaller portions are also recommended. Non-starchy vegetables like kale, spinach, and broccoli, and choosing lean meats and skinless poultry. If certain meats are restricted from diet because of religious practice, more fish or bean dishes can be substituted and provided for more nutrients and fiber. The written education brochure will include assistance with meal planning and choosing whole grain products, understanding food labels, and encouragement to eat at a regular time and consuming similar amounts of carbs to keep blood glucose consistent are also part of this step. Step 3, activity. Many chronic conditions are elevated or controlled by regular exercise. Type 2 diabetes is a perfect example that exercise can help and control disease. Studies reflect lower blood sugar levels for those who engage in regular physical activity. Many type 2 diabetes could stop taking medication after commencing a physical fitness regimen. Exercise will help with the success in step 1, losing weight and providing more energy at the same time. Step 4, rest is the crucial element in step 4. Sleep loss worsens diabetes. Studies indicate sleep deprivation leads to increase in the hormones that make one hungry and decrease the hormone that suppresses appetite, making one more likely to overeat. Insulin resistance is also an issue for diabetes that do not get enough rest. Consistent waking, working, and eating routines help synchronize sleep-wake cycles. Step 5. Once demonstration of the glucometer takes place, you will follow up the office to return demonstration of its use. The written education package includes instructions about keeping up records of sugars. Testing your blood sugar does not replace the need for office visits and lab work as an A1C. Will provide better evidence of your ability to control the blood sugars. Attend scheduled appointments and schedule an eye exam. As part of the education package, after each teaching session, we will evaluate your level of learning. We will test to see if you remember and understand what has been taught and see how you apply the knowledge. The education package provides lists of websites or phone numbers. Included in this information are federal level organizations like the American Diabetic Association, the American Diabetic Association's Consumer Nutrition Information Line. At the state level, contact the Florida Department of Health or the Diabetes Foundation, and locally the library or the Florida Hospital Diabetic Center. There are a number of resources listed on a web-based directory from the Office of Minority Health. There are the Florida Department of Health that is dedicated to diabetes. Nurses typically advocate for conventional treatment. If you believe in acupuncture, biofeedback, dietary supplements are complementary and alternative medicine, also known as CAM, you can be encouraged to explore alternatives as long as you disclose treatment with your primary physician. Relaxation techniques may be helpful, especially when out on the road for a long period of time. However, some herbal medications may interact with your prescribed medication or cause adverse reaction. There are many alternative therapies available. If interested in seeking out a CAN practitioner, our clinic can refer you to a respected and trusted advisor for diabetic patients. And now we'll do the glucose monitoring demonstration.
Mr. Minisee, in this portion of the demonstration, we're going to show you how to use your free glucometer. You received the glucometer from Accucheck Aviva, and it comes with an instruction book, so at any time you can review what's in the book. And we're just going to do basic instruction on how to load so that you can check your blood sugar and how to check it on the machine. Okay, just some basic tips. The first thing that you're going to want to do, and in order to draw the blood, you're going to need to load your lancet. So just take that and push it down in there until it clicks. Put your top on. Okay. And then we're going to cock it like so. It's already been set to depth, and you can practice to see how deep you want it to go. I'm going to put it at 1. Okay, we're all set at 1. First thing you're going to do is wash your hands, and then you're going to take an alcohol swab, or you might have a cotton ball at home. Put some alcohol on it and wipe the area that you want to draw the blood from. Since we have it caulked already, you'll notice a little button here. We're going to press this button, draw the blood. Give it a little poke. Turn your meter on. Little on button to the side there. And it's going to tell you to put your blood strip . Place your blood strip, and now it's going to ask you to go ahead and draw the blood. There we are. Once the blood's there, we just wait for the reading, and it has a reading of 130. I just ate.